I'm Dr. Jackline Lidubwi. I'm a journalist, and I'm also a media trainer. I'm the founding producer of Able Differently on KBC Channel 1. Anyone who's watched Able Differently? Yeah, so I'm the producer of Able Differently. I started the program 15 years ago as a program to give opportunity for persons with disability to air their opinions, their challenges, their wins, and anything about disability, and also to give persons with disability to be presenters on television, because in mainstream media, we don't see persons with disabilities as presenters. So Able Differently is the only program that has presenters with disabilities. So I'm going to talk about digital self-advocacy for people with disabilities, and I'll be presenting on my behalf and behalf of Dr. John Davula, whom we did the research paper together. But just to talk about, mainstream media hardly features stories of people with disabilities. So when we see stories of people with disabilities in the media, is maybe today we'll see because there is inclusive conference, right? And then maybe when there is World Disability Day, World Cerebral Palsy Day, but hardly we get stories of person with disability being featured. And then when they are featured, it's stories of pity, heroism, stories of inspiration, but not positive portrayal of disability. So social media is a game changer, all of us knows that. But however, access to social media remains a challenge to many Africans with disabilities. Also, people with disabilities have not taken fully advantage of social media for self-advocacy. So this discussion is about self-advocacy, how we can break stereotypes and barriers. So the alternative of power of alternative media. Social media can play an important role in influencing society attitudes towards disability. We know people with disabilities are viewed in different lenses. You know about the historical lens, the traditional lens where they say people with disabilities are cursed, or if you have a child with disability, maybe someone did a mistake or you did a mistake to your grandparents. Such stereotypes, they are the lens that the society live in. But social media can change the negative public image about people with disabilities by documenting positive and success stories of persons with disabilities, utilizing progressive language to report on people with disabilities, and self-advocacy through social media. I have already said I'm a journalist. So as a journalist, we are not taught on how to report stories of disabilities. That's why there's a gap in the media. But also when we report from our own background, from our own tradition, because media doesn't live in space. We live among people. So if we live among people who call people with albinism zeru, that's what you will find maybe a media person talking about that. And you know that is a derogative term, and that's why we say language has power. So if you call someone with albinism zeru, meaning an evil spirit, that's why you see people with albinism, when they talk, they are told go to Tanzania because they'll be sold in Tanzania and maybe someone will become rich. Those are just stereotypes, which we can demystify using social media, because social media is a game changer. So why does it matter? There are several portrayals that have been identified, like people with disabilities are pathetic, object of curiosity, sinister, or evil, the super cripple, laughable, as a burden, and unsexual. This is according to Paul Hunt, 1991. So when we watch media, these are the stereotypes we see in the media. So what about, there's also ableism. So ableism refers to attitudes in society that devalue and limit the potential of people with disabilities. And then there is a social media can also amplify ableism. So when people joke freely and say you are crazy, that's so lame, she's such a psycho. When we share stickers, memes on social media that diminishes people with disabilities, it is unacceptable because it stigmatizes person with disabilities. So meaning we are just removing the stereotype from our society to the mainstream media. Now we are putting it now to the social media. So like the meme up there. So get you a man who will never lay a finger on you or walk out on your life. And then they put there that meme. That is, people will now start laughing about it and think it is something which is funny, but this is devaluing persons with disabilities. That's why we are saying we should look out for them as people with disabilities or champions of persons with disability, and tell people, stop the putting up such memes. This is devaluing people with disabilities. And then there is this also one. Short people are the reason children's shoes are expensive. It was trending sometime back in Kenyan social media. And then there is, I've looked around some harmful content that was going around. This is a very respected judge in Kenya, but he has a mental disability or psychosocial disability. So during any Kenyan here will remember that time when he had gone for the interview and people were really joking around about it and even humiliating him. And then on social media, I got it from our WhatsApp group and I was really quarreling people in that WhatsApp group. You see someone saying imebaki nionje, alafu. So those who are sitting near Kenyans, they can translate to you what it means. It is very derogatory. But people you will see such jokes around on internet, on WhatsApp. You can see it on Facebook, and people are just laughing about it. So we are saying social media is a game changer. But if we are not keen, it is also going to mess us up, and it is also going just to amplify the stereotypes that are there about persons with disabilities. So I'll talk about a project that I led in sub-Saharan Africa, and I worked in several countries, and how we use social media to change the stereotypes and even to empower women and persons with disabilities. So in Tanzania, we worked with Lukiza Autism Foundation. And for Lukiza Autism Foundation, we trained them on social media use for advocacy. And Lukiza used their social media to reach over 1.2 million Tanzanians during their disability awareness campaign. They have like Autism Run every April. So during that year, they did that and they gained 1,000 followers on Instagram, and they increased their social media engagement by 980,000. So what we do mostly, we train organizations of persons with disabilities. We train them on how to use social media, how to maximize the use, because you can have paid posts. So we give them some little money so that they can be able to use that to be able to increase their engagement with their community. And in the process, we also tell them about the negative stereotypes about disability. Also, there's an organization in Tanzania called Yowido. So in Yowido, we worked with the youth with disabilities, and this is one of our youth, and using social media just to talk about her condition, telling people she's not cursed, she's okay, it's just she can be able to do anything and everything. And she got an award, CFEA Awards 2022, because of using social media to just highlight the issues affecting her and the community who lives with her condition. And then in Cote d'Ivoire, we worked with the CAFI. It's an organization for persons with disabilities in Cote d'Ivoire, and they use their social media to reach an online audience of 100,000 people. They also formed networks with Médecins Sans Frontières, One Women, and NGO Human for the World. Also, when they were now on social media, Congolese artists reached out to them and proposed to do a song for them to promote disability. And even politicians have reached out for them and promised them to implement some disability policies. So these are just some of the examples of the power of social media. In Liberia, they started a 1-hour inclusion program called the Inclusion Hour, whereby they featured people with disabilities, the stories they are doing, and just talking about disability for 1 hour on social media. And for all these projects, we were training them, giving them just some few funds and just capacity buildings a lot. In Cote d'Ivoire, we also worked with an organization of women, and they reached 13,973 people through social media, and more women with disabilities, specifically those who from the union, have become interested in using social media. They never thought that they can use social media. And also before the campaign, most of the women with disability didn't know how to create and share content on social media. And after the campaign, all the women were interested in learning and even using their social media platform to be able even to sell their wares, to sell everything, to sell the small things that they do in their union. So most of the time we use the hashtag Inclusive Media Project and the project activities by partners. So if you just go to Inclusive Media Project, you can see some of the work we've done online. So we say social media has opportunities to have people with disabilities who are fully aware of their power, to guide and influence discourse around people with disabilities, and also to encourage public discourse and to change perceptions about people with disabilities so that we don't have demoralizing or devaluing memes online, to raise awareness on issues surrounding education for people with disabilities, to ensure content targeted towards people with disabilities produced in accessible formats, and to create online disability champions. We also did a paper on sexual reproductive health of women with disabilities, and we used WhatsApp so that we can be able to get our results. So that is just some power of the power of social media. And also there was this madam, I think from which school, Chepreteret Girls Nandi, talking about inclusive education and how they had a girl with disability joining them, and they were happy to invite them in the school community. So we can use social media to do so much. And I will end with a quote by Chimanda Ngozi Adichie. The problem with stereotypes is not that they are untrue, but that they are incomplete. They make one story become the only story. So some stereotypes, when people talk about some things, they might be true. But if it is just that the single story, it makes everything become like that is the only truth that is there. Thank you. And any question?
Hi, everybody. I am Mr. Tab from South Africa, and I am from Skills Village Radio. It's an online radio station that advocates for the rights and awareness of persons with disabilities. So I've got a question then, just to find out through your journey, what has been one of the challenges putting together this kind of content or information through the journey? Because I do understand there's always these hurdles that you experience through these journeys, especially the journey of persons with disabilities. What is the challenges that you have experienced, and how did you encounter? And the second question I would love to find out is, have you done anything in South Africa? If not, I would love to avail ourselves, because we are here to, I love the statement that we want to tell our own stories. We are tired of people telling our stories and portraying it in a wrong way. So we are now available as media gurus or persons with disabilities who want to tell our own story. So it's only great that we are all here today and tell our own stories. So let's partner and let's do something very great, and let us tell our story the way we want to tell our story. Thank you.
Okay, thank you for your question. I'll start with the last one. It is easy because I've not done any training specifically for South Africa, but I think I participated in the UNESCO World Day, and it was in South Africa. So I did some series of trainings which are online, but specifically in South Africa I've not done. And then the challenges of working with persons with disability or telling stories of persons with disabilities, it is even the expectation of the public. Public thinks when you are telling a story of person with disabilities, it should be a story of Woye, or it should be an inspiration story, or I don't know which story do they expect, Anthony. Now, Anthony is one of the first people I featured in my program when I was starting. But now, with Anthony and many other people, we've managed to tell positive stories of persons with disabilities. So there's just this expectation of the audience. That is maybe the main challenge I have faced. And even journalists, now when I train them and then I tell them, there are several angles you can talk about disability. Like when you are talking about politics, bring a person with disability, bring a man, bring a woman. That will bring diversity, and people will see a person with disability can talk about politics, they can talk about education, they can talk about agriculture. But if you just bring a person with disability during the World Disability Day, they will just imagine only this person with disability can only talk about their disability and disability. So talking to the media and even making them understand they need to diversify how to interview, to have content of persons with disabilities, and also to tell them they don't even need to overhype disability stories like that one of Godaline Kakuya, the golden girl. You don't overhype, because if you overhype, you are giving over expectation to other people if they have albinism or that the particular disability. So just making them understand and being on the same wavelength, it is work. But we do successful trainings like for 3 days, and during those days we have persons with disabilities talking to them, giving their stories, and then we have managed to create at least champions of disability across some countries in sub-Saharan Africa. I won't say all, but most of them.
Okay, I would want to cover in matters autism. You realize that most media stations in Kenya don't look at autism from a medical lens. And I have a very big concern regarding that, because they were never trained on models of disability. So most of the time they look at autism from a medical model lens, to look at it like it's a disease. What have you done what is your recommendation to Kenyan media stations, especially when it comes to awareness, especially on autism, which was covered last month? What would you advise them on positive reporting, especially in matters of understanding about autism, but from a human rights perspective?
Okay, so what we do, the first day of training, we do understanding disability. In understanding disability, I make sure the journalists can be able to differentiate between traditional models, the super creep model, the human rights model, the social model, the medical model, even the religious model. There are several models. So we tell them all those models so that when they are doing their stories, they don't become, they don't do those stories in those religious models that someone has to be healed, medical model, someone has to be healed, traditional model, someone is cursed. We insist on the social model, and also the human rights model, because those ones are incorporating. The human rights model, especially because it is about inclusion and participation of persons with disability. So we go with the human rights model from the beginning to the end. And during the second day, we do about terminologies and language of disability reporting. We tell them, like the word handicap, it comes from during the Second World War, I think, when the French soldiers were fighting, and then they were maimed. Many of them lost their limbs, their legs, and then they were on the streets, removing the cape from their head, begging, and when they were begging, they were saying it is a cape in the hand. So that was long time ago. We cannot continue using those terminologies of long time ago in this modern time. Nowadays, we have people with disabilities who are engineers, politicians, professors, lawyers. We've seen them, senators. So that's why we tell them we have to change the language of reporting. Times has evolved, people have evolved. So we teach them about terminologies and language. But my friend, to get all the journalists to train them, it is a lot of work. That's why even I tell organizations of persons with disabilities, during your programs, have some trainings for capacity building to journalists. It will be of your help, because they will know how to report your stories well. So don't just leave everything to journalism, because nowadays media is also suffering a lot of capital. They don't have money. Social media has taken everything. They're not even paying the employees. They will just want to put a bullet on air. They will not even care about reporting underreported areas. But if we give them capacity and if we are proactive, then our stories are going to be told in a better way. Thank you.